Hi.
A racing heart, sweating palms, and drying mouth is something that we've all experienced at one point in our lives. We usually refer to this as anxiety. I've had a few life events in my life that have caused a great deal of anxiety. The first one I recall was when I moved to New Jersey at the age of 15. I was a sophomore in high school, left behind all of my friends in New York. The anxiety that I experienced was a great deal. The most recent was losing my job. I was nearly 30 and needing to start all over again. This also created a great deal of anxiety for me. Anxiety is something that everyone can relate to, but what's the difference between normal anxiety and an anxiety disorder? Fortunately, there are many websites and information available to distinguish the difference between anxiety and anxiety disorders. The one I'm going to discuss today is general anxiety disorder. Some of the websites I've used that have given me a great deal of information are the National Institute of Mental Health, Anxiety and Depression Association of America, Calm Clinic, YouLife, and the Recognizable Mile Clinic. According to the National Institute of Mental Health, nearly 7 million Americans suffer from general anxiety disorder, also known as GAD. Mostly women experience from this disorder, and it develops during childhood or middle age. This disorder has also been linked to genetics. So let's go over how you distinguish the difference between a normal anxiety and a general anxiety disorder. There are several differences, and identifying them is the first step. YouLife, a resource for college students, has a few key factors that they like to point out. Stressors. With normal anxiety, something such as an exam, an interview, or even given a speech may trigger anxiety. However, somebody with general anxiety disorder will find it difficult to get through day-to-day tasks, such as paying bills. The intensity level and the length is also another key factor. With normal anxiety, a person may get a little edgy before an exam, and it only lasts a short period of time. However, somebody with general anxiety may start experiencing anxiety several weeks prior to the exam. The symptoms are very intense and can possibly last weeks or months after. Impairment in daily life is another factor. And there are other physical symptoms and emotional symptoms that may occur. So now that we've determined what's the difference between normal anxiety and general anxiety, let's take a look at what these physical symptoms are and if treatment is necessary. Sources such as the American Anxiety Disorder Association, Mayo Clinic, and Calm Clinic recognize a common list of physical and emotional symptoms that indicate a disorder is present. Emotional symptoms may include irritability, edginess, a feeling of uncontrollable, apprehension, putting things off just because they're too overwhelming. You can't relax or even focus. Physical symptoms may also be confused with other health conditions. Flu-like symptoms such as nausea, diarrhea, or stomach pain. Shortness of breath, dizziness, lightheadedness, which is commonly confused as a heart attack, something that my father has experienced. Muscle tension, headaches, tremors, twitches can also be present. Two other physical symptoms that could cause more health issues than you would know are insomnia and fatigue. So how is GAD treated? Fortunately, there are a variety of different treatments out there for GAD. The first and most common that is used is cognitive behavioral therapy treatment. This teaches the person how to identify negative thoughts or behavior and replace them with positive ones. Anxiety and Depression Association of America also recommends meditation, yoga, and exercise, which have all been proven very effective for treating anxiety. In rare cases and severe cases, when cognitive behavioral therapy doesn't work, medication may be needed. Antidepressants, familiar ones are Paxil and Zoloft, or benzodiazepines, such as Valium and Xanax. So what does this all mean? Shockingly, it's more common than you'd think that people suffer from disorders like general anxiety disorder and not just a normal anxiety. If you are suffering from various physical and emotional symptoms mentioned here today, it could very well be general anxiety. But there's no need to panic just yet and run to the doctor. If the anxiety is prolonged, such as 6 months or longer, the physical symptoms are very intense, or are interrupting with your daily life, medical attention may be needed. There's no reason to suffer with anxiety. So rest assured, there is treatments without medication that are available. If you believe your anxiety is more intense than just a normal anxiety, seek treatment right away and begin living life again.